What I was trying to settle is the knowledge, whatever we understand about the GI, anatomy and physiology, that knowledge we are going to use it for the designing. So delay, what is the problem associated with the delay, or what is the consequences which can happen because of the delay in the gastric emptying? It can result in the prolonging the onset of action. Please remember, why onset of, maybe I want an immediate painkiller action. Okay, I want my pain to be relieved immediately. Because of this delay in the movement, and why the delay in the movement of the drug is happening, emptying time is delayed. It has become slow, that is delay. That is the best term to tell is delay. Because it is delayed, the tablet, whatever I have taken, it is not reached at the point of absorption, and now the onset of action is reduced. I was just trying to tell that in the AUC curve, I don't know whether you have can turn back your page if you have written minimum effective concentration and the maximum effective concentration, that is a toxic concentration. I made you right. Minimum effective, one line, and minimum toxic concentration on the top. Okay, wherever the AUC line touches at the minimum effective concentration, and wherever that is called as onset of time. What time the line touches, that is your blood concentration touches the minimum effective concentration, that is called as the onset of action. Okay, so that action will be delayed because of the delay in the gastric emptying process. Later on, the next consequences may be irritant. So unnecessarily your drug getting exposed. I mean, you are making your stomach to get exposed to the drug. So you know the drug is causing irritation, but that will be very mild, which can be ignored. But what happens because of the delay in the gastric emptying, now the irritation will persist for very longer time, and it becomes an inconvenience for the person who would have consumed the drug. And aspirin is the best example for that. Okay, and later the third thing which can happen is unstable. So those drugs which is not stable, and it is made to stay longer time in the gastric pH, and because of this, what happens now? Again, there is a instability or the stability issues of the drug. So delay in the gastric emptying can be disadvantaged because of these reasons. So this is what the knowledge we have got it from the anatomy and physiology of the stomach. So delay in the gastric emptying time, we know stomach has acidic pH, and those drugs which need to have an immediate action, or those drugs which is causing irritation, increases the irritation because the longer residence time of the drug. And the last one, it becomes unstable. I mean, the stability of the drug will be affected because of the presence of the pH. The next one is C. That is what happens, we understood, the drawback. Now, there is a thing that rapid gastric emptying time is advisable. We actually recommend it. We actually want that to happen. See the situation. In some cases, we don't want that to happen because of whatever we could understand in the previous slide. That is, these reasons. We don't want that to happen because of all these reasons. Now, I want it to happen. The next thing is the gastric emptying is advantage in some cases. Let us see what are those examples. So rapid onset of action is desired, okay, where, we want the drug to be, emptying time be faster. I hope you are understanding. You want the emptying to be faster. The same thing, whatever the delay we understood, now advantage of the faster. It's an indirect question. So by chance, if they ask you what are the drawbacks of the delay in the gastric emptying, these are the drawbacks. Okay, and next, what are the consequences of the rapid gastric emptying? Yes, it is happening faster. Definitely, whatever the drawback you have written previously, you are converting that into an advantage because you're making the content to move faster. You're making the gastric emptying faster. Okay, and that rapid onset of action is acquired because of the rapid gastric emptying process, especially in case of sedatives. And dissolution occurs, for example, for those drugs where the dissolution occurs in the intestine, especially like enteric-coated tablets, and which are not stable in the GI fluid. Okay, we expect the gastric emptying to be faster. And those drugs which are having carriers in the small intestine, we expect the gastric emptying to be faster. So what can I say here is, when you expect or when you want the gastric emptying to be faster or rapid, The reason, justify the reason for advantage of rapid gastric emptying. Why you want the rapid gastric emptying? Because I want the drug to exhibit the rapid onset of action. I want the drug to undergo dissolution, which is better, which is happening in the intestine part. And I want the drug to be stable or overcome the stability issues which is there in the stomach. So I want the drug to move quickly out of the stomach. And the last one, I know the drug is having the carrier in the small intestine. In that case, I don't want my drug to be wasting the time in the stomach. So in these cases, it is always advantageous, means we want the rapid gastric emptying to happen faster. Right. Okay. So delay, this is what I was trying to the other one. I recommend the delay in the gastric emptying time because it can be an advantage in some cases. I want the emptying to be slower. I want the drug to move in a very slow manner in the stomach. For those, when it is recommended, for those drugs whose dissolution is dependent on the presence of the content, especially the poorly water soluble drug. So I've given the example is glycoflavin here. I'm repeating. It's a highly lipoidal drug, means water solubility is very low. So what happens? Its dissolution happens better in the presence of the food. The question is why? Why its dissolution happens better in the presence of the food? Because the food get digested in the stomach in the presence of the whatever the secretion happens there, and it undergo emulsification process. It forms the micelles, and in the presence of the micelles, similarly this glycoflavin also undergo the digestion process, and it gets converted into micelles in the presence of the fatty substances, and thereby its absorption, dissolution is enhanced, and then the absorption. So in the presence of the food is recommended where you want the gastric emptying to be delayed. So indirectly what I'm trying to say is the presence of food actually delays the gastric emptying. Because you can imagine a lot of food we would have eaten and it's slowly it is moving in its own pace in the stomach. And everything will be delayed actually. When intestinal transit will also be extended, prolonged. So the chrysoflavin, one example you remember, which is a polysoluble, whose absorption is better and dissolution absorption is better in the presence of the food. So food promoted drug dissolution, they are called as. So disintegration, the second one is disintegration dissolution is promoted by gastric fluids. In the sense, when the dissolution is a better, the process, the dissolution the process is happening better in the presence of the disintegrates and the disintegration and sorry, in the presence of the food. Means both the disintegration and the dissolution is promoted by the gastric fluid. It is dependent on the gastric fluids. Then it is better you make the drug to stay for a longer time in the stomach. So these are the consequences which happens with respect to the gastric emptying time. We are trying to understand what is gastric emptying time. We got to know what is gastric emptying time. This is time taken for the content to get emptied from the stomach. Okay. And what happens when it is delayed? We got to know this is what happens. And the delayed can be an advantage in case of the drugs which are poorly soluble, or the drugs which disintegration is dependent on the gastric fluid. This is recommended. And why we want the rapid gastric emptying to happen? Because of these reasons: for the rapid onset of action, for the dissolution happening in the intestine, to improve the stability, and to make the drug to reach the target site, that is the target absorption site, that is the smaller intestine. Okay. Now, this table, if you see, this is a discussion for the factors influencing the gastric emptying. Again, it is part of factors affecting, that is the anatomy and physiological factor affecting the absorption. Within that, this is the factor affecting the gastric emptying particularly. And gastric emptying is the factor which affects, that is the anatomy and physiological factor. And this gastric emptying, again, it is affected by these many factors, whatever you are seeing in the table form. So volume of the ingested material, you can just see what are so many factors are affecting the emptying time. In what reasons, in what condition the emptying time is delayed or fastened, everything depends on these factors. So volume of ingested material, type of meal, temperature of food, body position, GIT pH, emotional state, disease state, okay, physical state of gastric content, presence of food, viscosity, exercise, and other drugs. So you can just list out this, the left side part, whatever you can see, you can write down that volume of ingested material. So volume ingested, see when what is ingestion? Nothing but consuming through orally. That's called as ingestion. So as volume increases initially and increase, so as volume increase initially and increase, then a decrease in emptying time takes place actually. There's a sentence error. As the volume increases, the gastric emptying time initially increases and then decreases. So initially it might be faster, later on it becomes slower, emptying time reduces. So bulky material tend to empty more slowly than liquid. So they are just comparing with respect to the nature of the content we are consuming. So more like bulky materials, it's like thick material, whatever you're consuming, the solid material you're consuming, it tends to move very slowly than the liquid foods. So type of the meal, this is important. Carbohydrate, protein, fats, they are kept in the sequence. Means carbohydrate increases gastric emptying rate compared to proteins and the fats. So increasing in the gastric emptying means it's quickly it is removed out of the stomach faster. So you can imagine the fats, more amount of fatty food we consume, that results in the delayed gastric emptying. The emptying rate reduces. Okay. So this knowledge is also information where they recommend the patient to consume the what type of food has to be taken is suggested based on the nature of the drug. For example, glycoflavin, if it is there, maybe, maybe it is usually recommended along with the food. Deliberately, we want the person to consume the tablet immediately after the food. So it's an advantage because glycoflavin solubility is dependent on the dissolution is dependent on the presence of the food. But those drugs whose dissolution is affected, is hindered or stopped in the presence of the food, we recommend them to take the tablet after certain duration of the time, even half an hour gap or 1 hour gap later. Okay. Even the temperature of the food also influences the emptying process. Increase in temperature, increase in emptying rate. The hot food, whatever we consume, the emptying rate will be increased. The body position, lying on the left side decreases emptying rate and right side promotes it. To just memorize these points. Okay. And coming to GIPH, pH, there's a lot to discuss with the GIPH. We already understood about this. Retard a slow stomach, retarded is at slow stomach pH and promoted at higher alkaline pH. So compared to the pH condition at stomach pH, that is acidic pH, usually it is slower compared to the alkaline. Alkaline pH, it increases, at the acidic pH, it decreases. Fine. By chance, the consumed food is altering the pH of the GI fluid, that is indirectly going to affect the gastric emptying time. Emotional state, anxiety promotes the emptying. You feel like eating more during, I don't know, many of you, I don't know whether you experienced it. You feel like always hungry because of the anxiety, whereas depression retards it. But some people have a habit of eating chocolate in the depression, there is a different thing. Those are the mood elevators. So don't correlate that to this depression retarding. Okay. This is with respect to the food we consume. The anxiety promotes the emptying and the depression retards the emptying process. Disease state, the another thing, depending on what is the disease condition, diabetic, gastric ulcer, hypothyroidism retards. So whoever is suffering from the hypothyroidism and diabetic, they generally have the low metabolism. Okay, retards. Also they have low metabolism. So hypothyroidism retards the gastric emptying. Always they feel like full. So while duodenal ulcer, hyperthyroidism increases emptying rate. So the one example, hypothyroidism, hyperthyroidism, if you remember, the metabolic activity is high. Maybe this is one of the reason. I'm telling this is not, this is the only reason. Maybe the emptying time will be so fast that the person always feels very hungry in the hyperthyroidism. The metabolic process is high, and also the digested food, everything is pushed out quickly out of the stomach. So hypothyroidism is quite opposite. Okay, so disease state also matters. Physical state of the gastric content. The same thing, the volume I said, the wall. All these are interrelated. Solutions or suspension empty more rapidly than the digested solids. So compared to your solution, a normal liquid state or suspension state, and it empties more faster than the digested solid contents. So for example, if you compare with the dosage forms, uh, suspension dosage form or the solution dosage forms or your tablet, if I compare these three, so solution dosage forms results in the faster emptying. So you can just correlate with this knowledge. The presence of the food, smaller particle are emptied faster, definitely, compared to the bulker one. That is a, so example is tablet and capsule. Compared to the tablet and capsule, your suspensions will empty faster because of increase in the emptying rate. Viscosity, greater the viscosity, lesser the emptying rate. Rate of emptying is greater for less viscous, in the opposite. More the viscosity, it get delayed. It moves very slowly. So emptying rate the emptying time will take more time. Exercise, vigorous exercise reduces emptying rate. Remember this, maybe we'll always have the wrong impression. Vigor exercise results in more, we feel like maybe emptying rate will be faster, we feel. But actually, the emptying rate decreases because of the vigorous exercise. And the next, the drugs, associated drugs, which are like drugs which we are consuming. Ethanol, I already told yesterday, it reduces the rate of emptying, and narcotic analgesics reduces the rate, and this metoclopramide increases the rate, and anticholinergic reduces the rate. So I don't expect you to buy all this, like at least the left side, whatever the factors it's been highlighted, you have to remember these factors and justify that. Why? On the second column, whatever is there, you just combine together, and that makes a paragraph. 5 marks question, easily it can be written. The factors affecting the gastric emptying time, if they ask, then you have to make the sentences combining these two columns.